The doctor is in, and the topic today, breast cancer myths. Breast cancer myths have been circulating on the internet and social environments for years, but we wanted to break down fact from fiction. So joining us today to debunk some of these myths is Dr. Scot Ackerman. He's one of the First Coast's leading oncologists. Dr. Ackerman, thank you so much for being here again.
Thank you, Casey.
And October being a very important time to talk about breast cancer awareness for women. So let's get into these myths. So the first myth being annual mammograms expose you to much radiation that they increase your risk of cancer. Is that a myth?
That's a myth.
Okay.
That's a myth. So again, October, Breast Cancer Awareness Month. You're going to hear a lot out there this month about getting your mammograms. Everyone's going to talk about breast cancer screening because it's Breast Cancer Awareness Month. So I want to make sure we debunk these myths before we get started. And so mammograms and the radiation is a great thing because we talk about that all month. So radiation is used in mammograms. Our modern mammograms, our digital mammograms, use very, very a small amount of radiation. The amount is so small that the benefits of early diagnosis far, far outweigh the risks of the radiation causing any problems with mammograms.
So it's good to be, knowledge is power, as we always say.
Always.
Knowing what what is going on in your body takes precedent, obviously, over what you think is a small dose of radiation?
Yeah, it's a very small dose.
Okay.
But, we just said knowledge is power. One of the things we talked about a few months ago, I had a woman on the show, her name was Julie. We found out from her, she was rather young when she was diagnosed with breast cancer, so we were concerned that she might have some genetic predisposition to breast cancer. And so we had her tested, and she was in fact tested positive for the BRCA gene, which puts you at a higher risk for developing breast cancer sometime in your life, and it's something that can be passed along to your children. So in Julie's case, we then went to her two daughters, and we tested both of them for this BRCA genetic abnormality to see if they were going to be genetically predisposed to be at a higher risk for breast cancer. The first daughter didn't have it, but the second daughter did. And so for her, we changed our recommendations a bit for mammograms. And there is concern about radiation, the radiation associated with those mammograms. So for women in the regular population, we recommend mammograms on an annual basis starting at age 40. But if you're at high risk, we recommend it earlier. And someone who's BRCA positive, who's really high risk, we really want to dial back the year that woman should start getting her mammograms, probably at age 30, and maybe even younger than that. But we don't have a lot of data to tell us what the effects of those extra 10 years of mammographic imaging and the radiation associated with that will have on inducing breast cancers. But because her risk is so high for developing breast cancer, I feel that the benefits of early diagnosis will certainly outweigh any risks of the radiation associated with the mammograms.
Okay. Another myth that you hear, breast implants raise your risk for breast cancer.
No, no, no. The implants do not put you at any higher risk, but the issue with breast implants is that they may hide breast cancer, depending on where the implant is put. And most of the implants today are put behind the pectoralis muscle, so the breast is still very much examinable. But some of the older implants that were put more farther forward would hide some breast tissue. So it makes it a little bit difficult for breast self-examination, but most women can do breast self-examination still with what's called a subpectoral breast implant. The mammograms, though, that we recommend, women with implants still should get mammograms on an annual basis, but the mammograms may be not as effective with the implant in, because the implant will hide some of the breast tissue. So you want to have what's called a diagnostic mammogram that could see more of the breast tissue, a couple more angles of images are taken, so the breast tissue is examined more thoroughly with the mammogram.
Another myth, breast cancer always comes in the form of a lump.
Well, breast cancers, hopefully we detect them before they become a lump.
Okay.
With mammograms, we find small calcifications that aren't really a lump, but a tumor does grow like a lump. But there's other indications of breast cancer besides a lump in the breast. Swelling of the breast, irritation of the skin, maybe some dimpling of the skin, some nipple pain or nipple discharge are all can be indications of breast cancer. Also remember, Casey, that not all lumps are cancerous. In fact, 80% of lumps in women's breasts are benign. They're fibroadenomas or fibrocystic disease or that sort of thing. What you want to do is do breast self-examination every month. And that way you'll know the changes. You'll know the normal lumps that you have in your breast. And if they're not there, if they grew from one month to another, then that's a cause for alarm. and you should see your physician when you notice that change to have additional testing done.
And then there's another myth that small-breasted women have less of a chance of getting breast cancer.
Yeah, that's again a myth. Whether you have large-breasted or small-breasted, your risk of breast cancer is the same. Large-breasted women, though, are harder to examine than small-breasted women. If you're doing breast self-examination or if a physician's examining the breast tissue, it's really hard to palpate the deep inside a large breast. Small-breasted women is much more easier to examine. But in either event, whether it's small or large-breasted, mammograms are still very, very effective. Mammograms can find lesions in a large breast just as easily as they can find lesions in a small breast. Again, you want to catch these breast cancers early. You want to get your mammograms and do breast self-examination every month.
All right. Thank you so much, Dr. Ackerman. We appreciate you being here once again for your insight and for sponsoring the segment. And Dr. Ackerman is with us every Friday. And next week, he will continue our discussion on breast cancer when we're talking about what happens after a mammogram reveals abnormal test results. So for questions regarding today's topic or any other health questions that you might have, just visit firstcoastoncology.com and you can confidentially submit your questions to Ask the Doctor.